Hello and welcome back to another Millennial Minute. I'm your host, Julia Sun. Today's topic, should the government be involved in healthcare services? You've already heard from our guests, Nate Lerner from Build the Wave and Erin Elmore from Turning Point USA. Welcome to the show. Look, if the government distributed our drugs and vaccines, the argument is the things would be more affordable. What do you think about that, Erin?
What does the government do that is currently affordable? I think that's a terrible idea. Governments in the United States specifically are known to be less efficient, overpriced, bloated, slow. You're not going to get the best healthcare if you get it through a government. Let the private sector dictate. Let the free marketplace figure out what works best. And I just don't believe that a government should really be involved in any aspect of our life or sustainable care. I think as Americans and as people, as individuals who can make decisions what's best for us, I don't want the government to tell me what I need or to be in control of my health care.
Nate, look, in an ideal world, everything goes to the right place at the right time. But the truth is, as Erin said, government isn't known for being very efficient. What do you say to that? And is there any way the government can handle this mess better?
Well, that's actually not true. So if you look at the most popular government program after Social Security, it's Medicare. And that is basically the government giving health care to older people. And what Democrats are advocating for is simply an extension of Medicare. It's to make that available to all Americans who want it. It's to cover the 24 million Americans who were uninsured before the pandemic, not including the 14 million additional Americans that are now uninsured. And right now, Republicans are basically arguing for a continuation of a deeply unpopular healthcare system, one where profits are put ahead of people, one where we have a country where the number one cause of bankruptcy is healthcare costs. So if you want to see a continuation of that, then sure, let's keep government out of healthcare. But if you want to adopt a healthcare system that every single other advanced nation uses, then the government needs to get involved. And is the government perfect? No, but the government doesn't put profits before people like healthcare companies currently do.
Yeah, the word I keep hearing from you is profit, and I hear that word a lot from other people on all sorts of government program. Erin, what do you say to that?
Well, we live in a capitalistic society, so I'm not mad that anyone makes a profit. Everyone that works in Washington, whether it's AOC or Nancy Pelosi, they get paid to be there. They are not there because of their altruistic intentions. They do get paid. Having said that, he alluded to programs that were popular. Things that are free usually are popular. So there's kind of a dangling carrot there that makes it a little bit biased, if you will. I understand that people do need healthcare, and I understand that healthcare can be expensive, but I do believe that it's best left to private citizens and private corporations in the country we live in, is the United States. I believe in capitalism. I don't believe in socialism. And every aspect of our life that the government takes over or controls is one step closer to a breadline. I'll pass.
Okay, I'll play devil's advocate for a second. Erin, what do you say to those Americans who just absolutely cannot afford health care on their own?
So then it's our obligation to pay. So someone has to pay is what we're saying. I understand that people have a hard time affording things, and there should be special assistance during those times for a limited amount of time, but it's more about training them to get jobs so they can afford healthcare. I think in America, we have to pick ourselves up by our bootstraps, and there is personal responsibility and accountability. Yes, there are temporary programs that are in place to help with healthcare or housing or things of that nature, but they should be very limited and very temporary.
And Nate, same question, but in a different way. What do you say to those on the board of those pharmaceutical companies and insurance companies? They have to make some profit to be able to keep living.
Well, they can go, work in any other industry. There's no shortage of industries in the U.S. to work in. The problem is that I hear a lot of buzzwords like freedom and capitalism, but the reality is in the healthcare system, you can't operate like that. When a private company is profiting off of your well-being, it is not in their best interest for you to be healthy, for you to pay a reasonable rate. It's their best interest to jack up the cost on pharmaceuticals, which we see, their best interest to jack up the cost of healthcare, which we see, and their best interest to screw you over as much as possible, which we see day in and day out, and it's why our healthcare system is deeply unpopular. So you can have a free system, or you can have one that actually works, and it doesn't work both ways. And the fact of the matter is, with healthcare, you need everyone involved in it. You need a system where people are put before profits, or it's going to be broken, and our current system is broken.
Okay, well, I don't expect us to settle this big question here in 5 minutes, so we'll continue this conversation another time. Thank you both for being here. And thank you for watching Millennial Minute. I'm Julia Sun. I'll see you back here next time.